So that's the subretinal implant story to date with the German subretinal implant. So now let's talk about a little bit about transcorneal electrical stimulation. And this has also been generated in Dr. Renner's group in Tübingen. Electricity in medicine is not new. I'm going to move along because time is moving. In ophthalmology, as Alan has talked, and Alan was probably the first one to show that, to show us really that small amounts of electrical stimulation can increase and help these patients to restore some vision. So a lot of people have been working on this in the past few years. They've been using the DTL electrodes that we use for electrophysiology and transmitting electricity through the cornea to the globe in that manner. So several of these experiments have shown a reduction of damage to the ganglion cells, reduced progression in RCS rats, a reversal of damage in animals with light-induced retinal degeneration. There's been a couple of reports of using this in patients with non-arteritic ischemic optic neuropathy with improvement, and patients with central retinal artery occlusions. So the potential mechanisms, as you've heard already, mostly is probably the upregulation of growth factors, a neurotrophic effect here. So with some of this, with these thoughts in mind, again, a prospective randomized study was done on a very small group of patients in Tübingen. There were 24 patients with retinitis pigmentosa, and the inclusion criteria was logMAR 0.02 to 0.9 with recordable ERGs and a recordable visual field with no macular edema or other ocular diseases. There were 3 groups. There was 8 in a sham with 0 threshold stimulation, 8 with 66% threshold stimulation, and 8 with 150%. What I mean by threshold stimulation is that if you gradually turn up the electrical energy in complete darkness, and you just hit the level where the patient just begins to see a phosphene or a light, then that's threshold. So we stimulate the patients at 66% of threshold and at 150% of threshold. So each patient is specifically characterized for a specific electrical treatment. And in this study, the patients were treated for 6 consecutive weeks. Once a week, they received a treatment of 30 minutes of the electrical stimulation. And this fiber was just placed across using a DTL fiber, using a biphasic 20 hertz system. And this is some of the results. There was a trend to an improvement in the visual acuity, mostly only in the 150% group. There's also a trend in the light-adapted ERGs in the 150% group, in the dark-adapted ERG, and mainly in the dark-adapted B-wave amplitude, we saw the greatest result in the patients with 150% threshold stimulation. Again, there's a trend in a positive for the 150% in dark adaptation, but the place where we saw the most positive result was in the visual field. With 150% stimulation of threshold, the patients improved the visual acuity by the central field by 20%. So the summary of that particular study is that this is a safe, non-invasive technique to provide some electrical stimulation. There's consistently positive trends for the visual acuity and most of the ERG parameters. There were no negative trends in any parameter. There are statistically significant results for the 150% stimulation, both in the visual field and the B wave amplitude of dark adapted ERGs. So I've covered both the subretinal implant and the results of the first studies with TES in a prospective randomized study. You know, this actually goes back a long way about electricity and vision. You know, in Philadelphia, you're all familiar with the famous experiments of Benjamin Franklin. And those were actually conducted a block and a half from where the Wills Eye Institute is. And in his treatise on experiments and observation electricity, he actually wrote, electrolyzing the patient, this remedy should be fantastically applied to the eyes in this manner to restore dimness of sight. So this goes way back to 1751. This is the group of Drs. Renner in Tübingen that has done all these studies. And we just were awarded a large Department of Defense grant, which will be beginning next month with TES for traumatic optic neuropathy and non-arteritic ischemic optic neuropathy. And we're finalizing a protocol right now for a large group of RP patients. The group in Philadelphia is hoping that we'll be able to start both of these studies in the very near future. Thank you for your attention.